I work at the intersection between your genes and your second genome, the bacteria that live in and all of us. In particular, as a dentist and as a researcher, I work on oral diseases that has these two components in them. My research concentrates on a disease called Generalized aggressive periodontitis that has rapid destruction to the tooth-supporting structures of teeth. And this is what we basically have to make the diagnosis based on. Here are two cases. Generalized aggressive periodontitis, or GAP, looking almost exactly the same as generalized chronic periodontitis, GCP. Both patients have a lot of local factors and a lot of inflammation. Now, here's the problem. If you misdiagnose generalized aggressive periodontitis as generalized chronic, you will be treating the patient in the wrong way. Both two things are going to happen. Treatment is going to fail, and you're going to need to repeat the surgeries again, meaning more time, more money for the patient. Now, to complicate matters even more, generalized aggressive periodontitis, GAP, actually also resembles another disease called localized aggressive periodontitis that also has rapid destruction of the supporting tissues, but it is usually localized to specific areas. Now, misdiagnosing GAP with LAP means that you're not going to be treating all the areas that has the problem, also increasing the chance of recurrence. Now, the difference between these is that both are rapid destruction, but one is only localized in specific areas, while the other one is generalized. So what you can see is that generalized aggressive periodontitis actually shares features of the two diseases, GCP and GAP. Now, the first thing that you would think is, well, is the clinical features basically a reflection of the microbiome that is in that area, the subgingival microbiome? And there's a rationale for that. Typically, when we think about a disease such as aggressive periodontitis, we think genetically. And there is plenty of evidence that says that generalized aggressive periodontitis or aggressive periodontitis of both forms have a genetic factor in them. There is strong genetic penetrance, but what the new studies are showing us is that generalized aggressive periodontitis cases actually live with people that have chronic periodontitis within the same households. Also, localized aggressive periodontitis, if left untreated, it can actually transform into generalized aggressive periodontitis. So that gives you an idea that how the environment actually shapes the microbiome as well. So that started us thinking, could LAP actually become GAP because of its microbiome? And the first thing we wanted to look at is this. Now, don't worry about what the axes are. Each dot represents a patient with one of the conditions. Two dots, if they're close to each other, that means that the microbiome are more similar to each other than two that are further apart. And what we saw is that generalized aggressive periodontitis lives in the intersection right between the two conditions. That got us thinking, could it be that the disease is actually a mixture between the two? And for that, we wanted for us to investigate that. There are three things we need to look at. Is it different species that live in there? Or is it the same species but different abundances? That is the amount of the bacteria that are in there. Or could it be a mixture between the two? First thing we looked at is the species. Same bugs actually live in all three conditions. When we looked at the second feature, which is the abundances, we found that yes, there are differences in the abundances. Then, when we wanted to look at the combination between the two, I guess we can talk about the mathematical formula, or if you think about it, the saying, birds of a feather flock together, that means that there's zero diversity. Now, as you introduce more and more and more species, you get more and more diversity. And this is what we found. The same diseases actually have the same amount of richness, meaning we have the same species in all the people, and it's merely a game of numbers that is happening in there. And that actually is interesting for us, because another saying, everything is everywhere and the environment selects. Well, there are tools now that actually help us look at that. One of them is called Co-Occurrence Networks, which helps us actually investigate how the bacteria interact with each other. Meaning, if one bacteria increases in the environment, how does it look like to the other neighboring bacteria? Does it increase or decrease? And what we saw, which you can see over here, so let me orient you on that one. Each line represents a connection between two species. The red lines are the same connections that was found in all three conditions, and the gray ones are the ones that are unique to that condition. But what you can see is that the gray line is actually predominant, or much more than that is of the red line, which indicates that while there is some shared environment, it's vastly a different environment in each one of those diseases. So we went a little further and we looked at how these species actually interact with each other. So these are also co-occurrence networks, just like the other ones that you saw, but we basically looked at how the species interact. A green line means that it is a positive connection, that is, they either go up or go down together, or the red one that are different. And you can see that the same species in each one of those diseases form very, very, very different friends and enemies in each condition to accumulate or to accommodate the environment that they live in. So next, we wanted to see, well, is this really just in the species level, or do they actually form big, big, big groups where they all interact with each other or not? And that's how we looked at it. We looked at what they call a modality to see what the clumps are. And you can see here that in each condition, they actually form new friends and new groupings with each other. So what that tells us is that even though we have the same players in these three conditions, they're playing very different ball games depending on the environment that they live in. So this made us think that the disease is actually somewhere in a spectrum where LAP, which is in one side, could very well get pulled more towards the center of that spectrum due to the GCP effect on it. And that actually has been a problem that has caused us to have multiple classifications within the past 100 years. The classifications have always tried to find where these diseases fall in terms of their pathogenicity. And we finally have evidence that actually gives us the first glimpse into this problem. So as a scientist, that makes me very happy because now we can finally go in the right approach on how to look at these diseases. And as a clinician, I'm hoping that this will be the first step into finding a chairside test where we can definitively tell our patients, yes, this is what you have, and this is how we can treat you definitely. Thank you.